Hello and welcome to Black Health Matters. I'm Daly-Mack, RN, your host, and today we're discussing a topic that affects us all: vaccinations. August is National Immunization Awareness Month, and it's the perfect time to explore the history of vaccines and their significance for people of color. Let's start by honoring the pioneers who paved the way. From Edward Jenner's smallpox vaccine to Jonas Salk's polio vaccine, these breakthroughs transformed global health. But did you know that people of color played crucial roles in vaccine development? Let's spotlight some of those unsung heroes. Before Jenner's smallpox vaccine, some people in Boston were inoculated against it. The process was introduced by a young slave named Onesimus, who was named after another slave in the Bible. The name Onesimus means useful, and he was. During the 1720s, when smallpox was responsible for many deaths worldwide, Onesimus explained to his master the inoculation process that was used in Africa. Pus from the skin of someone infected with the disease would be rubbed into an open wound on the skin of an unaffected person. This caused the person's body to build immunity, and they would not catch the disease. Many lives were saved by this practice. Then there was Henrietta Lacks, a name that resonates across time. Her immortal cells, known as HeLa cells, the name was derived from the first two letters of her first and last names, they revolutionized medical research. The cells exhibited an extraordinary ability to multiply in laboratory settings. Unlike other cells, HeLa cells doubled every 20 to 24 hours. HeLa cells played a crucial role in the development of the polio vaccine. Researchers used them to test the vaccine's effectiveness and safety. But her story also sheds light on ethical considerations and disparities in healthcare access. It highlights issues related to informed consent and patient rights. In the 1950s, the collection and use of her cells were acceptable, but lacked proper consent. Over time, laws protecting research subjects have evolved. Institutions like Johns Hopkins now prioritize informed consent and respect for patients and their families. Advocacy efforts continue to honor Henrietta Lacks, raise awareness about her contributions, and ensure equitable treatment of her family's medical information. And let's talk about trust, mistrust, and vaccine equity. You know, trust matters. Communities of color have faced historical injustices, including unethical medical experiments, such as the infamous Tuskegee experiment, where vaccines were withheld. This mistrust understandably impacts vaccine acceptance. And then we come to COVID-19. The pandemic brought vaccines again into the spotlight. The current political climate caused the vaccines and even the pandemic itself to be politicized, with one party blaming the other for the outcomes. The safety of the vaccine was called into question, and misinformation was spread from all corners. As a matter of fact, I received a message from a friend today about a supposed CDC alert about this new strain of COVID that was even more deadly than before, and you wouldn't even know that you had COVID because it had really strange symptoms like backaches and neck aches, but none of the congestion and cough that we knew of from the original COVID. Well, as it turns out, that is a hoax that has been circulating since 2022. But because it is sent out and they mention the CDC and they might mention the name of a doctor, and in this case, the doctor that was mentioned is not even a medical professional, but an educator. And because it looked like it was important and it really came from the CDC, this friend of mine, who usually checks things out for herself, was concerned. And when I let her know it was a hoax, she even questioned that I knew what I was talking about. But I assure her that this has been going on for 2 years, since 2022, and that, yes, COVID is still here, but nothing like in that so-called CDC alert. And so it still continues. But as usual, people of color and other marginalized communities, including rural communities, were unable to receive vaccines and are still having difficulty in some places as readily as white people and people in urban areas. It's important for community leaders, healthcare providers, and grassroots organizations to promote vaccine education, advocacy, and equity. Vaccines have saved lives since the 1700s. Most of us have received and made sure that our children have received all of their childhood immunizations without question. If you are concerned about any vaccine that is recommended by a healthcare professional, educate yourself. Google it. Look at the CDC website. Weigh the risks of not getting the vaccine if you don't think you need it. Could it possibly cause a life threatening illness to yourself or a loved one? For me, that's a no brainer. But I'd just like to thank you for joining me today. Remember, vaccines save lives. Let's honor our past, advocate for equity, and protect our future. Until next time, stay informed, stay healthy, keep spreading love, and remember, Black health matters.